Have you ever thought about the importance of the liver for your overall well-being? The liver is the real hero of your body, working around the clock to cleanse your body of toxins, absorb nutrients, and even regulate cholesterol levels. But what if your liver is signaling for help? In this video, we have collected 12 strange signs that indicate that your liver needs your attention and support. Fatty liver disease, fatty hepatosis. It is one of the most common liver diseases in the world. According to the World Health Organization, more than 25% of the world's population suffers from fatty liver disease. Among the risk groups are overweight people suffering from diabetes and an inactive lifestyle. Liver damage cannot be attributed solely to excessive alcohol consumption. There are many other factors that can negatively affect the health of this vital organ. These include the consumption of processed foods, excess sugar and vegetable oils in the diet, abuse of painkillers, as well as viral infections. If you are concerned about the condition of your liver, we recommend that you watch this video to the end. In it, we will also discuss some natural home remedies that will help cleanse the liver and prevent further damage to it. Taking care of the health of this organ is extremely important because it performs many vital functions in the body. So let's get started. Number 1. Pale chair. One of the first signals to pay attention to is a change in the color of your chair. Pale or clayey stools are a sign that your liver is having problems producing bile, which is necessary for normal digestion. The liver plays a key role in the production of bile, which is released into the intestine to help digest fats and nutrients. In case of liver disorders, this process is disrupted, which leads to a change in the color of the stool. Number 2. Nyctalopia. Nyctalopia, or poor night vision, is one of those strange signs that indicates not only eye problems, but also the condition of your liver. A deficiency of vitamin A, which is necessary to maintain eye health and support night vision, may be the result of insufficient liver function. Vitamin A is transported to the retina of the eye to support visual functions, but if the liver is stressed or cannot properly absorb this vitamin, nyctalopia occurs. Eating foods rich in vitamin A does not always solve the problem if the liver cannot process it. Therefore, if you encounter problems with night vision, it is important to pay attention to the health of the liver and possible violations of its functions. Number 3. Swollen right leg. A swollen right leg can be not only an uncomfortable problem, but also a signal of possible disorders of your liver. This condition, known as edema, can be caused by fluid accumulation in the lower extremities, and low albumin levels are one of the causes of this process. Albumin is a protein that is produced by the liver and performs a number of important functions, including maintaining normal fluid pressure in blood vessels. When the level of albumin in the body decreases due to liver disorders, for example, cirrhosis or other liver diseases, this leads to the formation of edema. If you notice swelling in your right leg or lower extremities, it may be a sign that your liver needs support. If the content of this video turned out to be useful and interesting for you, we recommend subscribing to our channel. This will allow you to stay up to date with all our latest materials and not miss the latest updates. Number 4. White or yellow bumps around the eyelids. If you notice white or yellow bumps around your eyelids, this is not only a cosmetic flaw, but also a signal of possible problems with your health, including the condition of your liver. These lumps, known as xanthelasmas, are the result of cholesterol accumulation in the body. The liver plays an important role in cholesterol metabolism, and if you have liver problems, it leads to an increase in cholesterol levels in the blood. Number 5. Right hand pressure. A feeling of pressure or discomfort in the right side of the chest is a signal of problems related to the liver and stagnation of bile. The liver produces and secretes bile, which is necessary for normal digestion. However, if the bile ducts are clogged or there are problems with the bile secretion process, This leads to bile stagnation and pressure in the right side of the chest. The discomfort associated with bile congestion manifests itself in various ways, including a feeling of heaviness, discomfort, or pressure. Number 6. Purple or red bumps on the skin. The detection of purple or red bumps on the skin, as well as light bruises and bleeding, may be a signal of a deficiency of fibrinogen, which is associated with liver function. Fibrinogen is a protein that plays an important role in the blood clotting process. It is produced in the liver and is necessary for the formation of clots that help stop bleeding when blood vessels are damaged. However, if the liver is under stress or its function is impaired, this leads to a decrease in the level of fibrinogen in the blood. Number 7. Cracked heels. Cracked heels are not only a cause of discomfort, but also a signal of vitamin B3 deficiency, or niacin, which plays an important role in skin health and many other body functions. Vitamin B3 is necessary to maintain the moisture level of the skin and its healthy state. It participates in the processes of regulating moisture in the skin and promotes the formation of a healthy skin barrier. However, if your liver is under stress or cannot properly absorb vitamin B3, this leads to a deficiency and, as a result, cracked heels and dry skin. Number 8. White or swollen nails. The detection of white or swollen nails is an alarming signal indicating serious liver damage or hypoxia, which is associated with insufficient oxygen supply to the tissues. The liver is involved in many biochemical processes in the body, including protein synthesis and metabolism. If the liver is damaged or does not function properly, this leads to abnormalities in protein synthesis, including nail proteins, which in turn leads to the appearance of white spots on the nails. According to a study conducted in the 1950s, 80% of people suffering from severe liver scarring had completely white nails. This fact indicates the presence of a strong relationship between the appearance of nails and the state of liver health. Number 9. Dark urine. Number 9. Dark urine is a sign of bilirubin accumulation in the blood due to liver disorders. Bilirubin is a yellow pigment that is formed when red blood cells are destroyed and is usually secreted into the bile of the liver for subsequent excretion from the body through urine. However, if the liver is under stress or does not function properly, it has difficulty filtering and removing bilirubin, which leads to its accumulation in the blood. This manifests itself in the form of dark urine, which usually has a richer color. Number 10. Jaundice. Jaundice is a condition in which the skin, eyes, and mucous membranes turn yellowish due to an increased bilirubin content in the body. If the liver is under stress or its function is impaired, it has difficulty processing bilirubin, which leads to its accumulation in the blood and tissues of the body. This manifests itself in the form of yellowing of the skin, the protein of the eyes, and mucous membranes. Number 11. Vascular asterisks. Vascular asterisks are red, blue, or purple dilated blood vessels on the skin that may be related to the condition of your liver. These vascular changes occur due to increased pressure in the venous system, which can be caused by disorders in the liver. The liver plays an important role in blood processing and blood pressure regulation, and if it does not function properly, it leads to vasodilation and the formation of vascular asterisks. Vascular asterisks may also be associated with an increased content of estrogens in the blood, which is also a consequence of liver disorders, since the liver plays an important role in hormone metabolism. Number 12. Itchy skin. The feeling of itching on the skin may be due to the accumulation of bile acids under the skin, which is a consequence of impaired functioning of your liver. The liver is involved in the formation and excretion of bile, which is necessary for normal digestion. However, if the liver is under stress or does not function properly, this leads to disturbances in the bile secretion process. This, in turn, leads to the accumulation of bile acids under the skin, causing itching and discomfort. If you find yourself with one or more of the above-mentioned symptoms, we recommend that you consult a doctor for an examination. Timely diagnosis by ultrasound examination will identify potential liver damage at an early stage and take the necessary measures to restore its health. Do not neglect the body's alarm signals, because early prevention and treatment will prevent the development of serious complications. Liver damage develops in 4 stages. Initially, excess fat accumulates in the liver cells, causing inflammation and the formation of scar tissue called fibrosis. If this process is not stopped, it can go into an irreversible stage of scarring, known as cirrhosis of the liver. This is the most dangerous stage leading to liver failure. Fortunately, the liver is capable of regeneration and recovery with proper nutrition and other methods of healing. For liver treatment, it is recommended to start the day with organic coffee, adding half a teaspoon of turmeric instead of sugar. Turmeric phytonutrients and coffee polyphenols will help reduce scarring and repair damage. It is important to drink at least a liter of water per day to thin the blood and facilitate the production of bile. The diet should include herbs and spices that cleanse the liver: ginger, turmeric, cinnamon, dandelion root, milk thistle, reishi mushrooms, green tea, cloves. To improve liver health, it is necessary to exclude oils that provoke inflammation: corn, cotton, rapeseed, soy, margarine, low-quality olive oil. They should be replaced with butter, ghee, extra virgin olive oil, and coconut oil, more useful alternatives. The diet should contain foods rich in sulfur: greens, arugula, radishes, garlic, broccoli, Brussels sprouts and cauliflower, mushrooms, eggs, fatty fish, walnuts, onions, green onions, broccoli sprouts. They increase glutathione levels, contributing to detoxification and removal of fat from the liver. It is important to give up processed, sweet, flour and starchy foods, fruit juices, and alcohol, since fatty liver dystrophy is provoked by fructose. To cleanse the liver, you can take supplements with bile salts and enzymes, but first consult a specialist. Early detection and treatment of liver damage will help prevent the progression of the disease and reduce the risk of serious complications such as cirrhosis or liver cancer. Take care of your liver today to enjoy a healthy and active life in the future.